Hey, I'm Dr. Hansen, and I'm the Chief Clinical Officer here at Nuvia Dental Implant Centers. I'm here to address a bunch of questions that we get from our patients and even people that are just looking into possibly getting dental implants. So sometimes we get the question, does making and doing my teeth so quickly mean that I'll have lower quality teeth as a result? Here at Nuvia, we use modern zirconia materials, and these materials are wonderful. They allow us to provide teeth for our patients that are lifelike and real, and also extremely strong. So of course there's no compromising quality when you get permanent teeth in 24 hours. We're not breaking any rules of material science, nothing like that. The answer is actually that we just have invested more, right? We have more experts, they're working longer, harder, more resources, more is being done at an organized, efficient pace so that someone can have a beautiful new smile the next day. And that's been our commitment from the beginning. So occasionally we'll get asked, hey, doesn't a patient need time to heal before we do anything for them? The irony about asking, does a patient need to heal, is funny because it was answered back in the early 90s when all on four or immediate, teeth in a day started to come out. We learned back then that you don't have to wait for full bone to implant healing before you attach something to a dental implant. So the same is true here, right? We don't have to wait for certain things to happen before we can move forward with certain steps. It's similar to, my mother-in-law had her hip replaced recently, and the orthopedic surgeon didn't say, now you're on bed rest for 6 months while we wait, right? She was up on it the next day. So advances in science, material science, medical devices like dental implants, and the materials we use to restore those implants allows us to move forward without waiting on certain things that have to do with healing. Permanent teeth are not any more uncomfortable than a temporary set of teeth. While permanent restorations, they're much stronger, obviously. They have much better material properties. Your gums really can't tell the difference between that. So there's no real detection in difference whether you have permanent teeth or temporary teeth as discomfort goes or as gum healing goes. So fortunately, you don't have to worry about that. Your permanent teeth are designed to last a lifetime. Dental implants also are a highly successful procedure and can last a lifetime. From person to person, it's very hard to predict, and certainly no guarantees can be made on exact, longevity of anything. The most important things someone can do for longevity are home care and taking care of your teeth, regular maintenance with your care team. And in addition to that, it's just your general health, right? So the healthier you are for the longer you are in your life, generally the better everything is gonna last. It's not a problem for any patient if they come see us and they have existing gum disease or infections with their teeth, inflamed gums or loose teeth. It's not a problem to have any existing dental and gum related disease or problems, because that's what we're here to treat, right? And so this treatment solves that, takes care of that, and it puts you on the path of healing to get over all of that. So we encourage anybody and everyone that is dealing with that to not be afraid that might, disqualify them or something. Come see us, let us talk to you. So if you're someone who is not sure what to do next with your dental health, we invite you to come in for a free consultation with us. We offer that to everyone, and we're certain we can help you. So a normal question from a prospective patient is, will I have some choice in the matter about what my teeth look like? Will I have, the option to choose? Every new patient has the opportunity to choose what the look of their teeth will be like. In fact, prior to even doing the pre-surgery appointments where we get records and get all ready, we will actually provide for you a few different mock-ups in picture format that kind of show you your face, your smile with some of the different shapes of teeth and what that might look. And that tends to be a helpful thing for our patients to aid them in choosing. Additionally, as a patient, you'll have your doctor that can help you choose and decide as well. That's a normal thing and something we are happy to support, and really can be a fun part of the appointment. So the length of surgery is different from person to person and from treatment plan to treatment plan. Generally, for a single arch of dental implants, about an hour of actual surgery, maybe 2 for 2 arches, but that can vary. It can be a little less, it could be several hours, just depending on the complexity. Fortunately, every surgical team at Nuvia has a dedicated anesthesia provider as well, and so our patients get to be asleep during this procedure and don't have to experience the discomfort of being awake. The two most common things to expect after your procedure are going to be swelling and discomfort. And that's probably true of almost any surgical procedure, and is certainly true with oral surgery and having dental implants placed. So swelling generally will peak right around the third, maybe fourth day after your surgery, and then for most people will start to go away and the swelling will decrease and things will return to normal. Pain and swelling for people is different from person to person, but most people are going to have kind of pain and swelling that will reach their peak within 3-4 days after surgery and then start to improve. And so most people after a week are going to be feeling much better, with every day, feeling better and better, more normal. Here at Nuvia, because we don't give temporary sets of teeth to people, you won't have a set of teeth immediately upon waking up from your surgery. Instead, we'll use the 24 hours to design and make your permanent teeth that you'll then come back the next day for and receive them then. As a patient, will I have a gap that develops between my gum tissue and my new teeth, and is that a problem? And the answer is no, it's not a problem. We actually anticipate that. And while not everyone is going to develop a gap, we recognize that some patients may have a small gap develop, but that's why we designed our teeth the way we did. Our process is built to be able to answer that. And so for anyone, as they heal, if a small gap develops, we have a solution that simply adds to that and is actually very simple. So it's really rare for someone to be unhappy with their teeth, with the result of their smile, just because we're really good at this. We do this a lot. We help a lot of people. We have a lot of experience among, many centers with many expert doctors. But in those extremely rare instances where there's something, truly wrong or someone is unhappy, we're a supportive team of caring individuals, and all a person needs to do is have a discussion with their doctor, with their care team, and discuss the issues they're having or the questions they have, and they'll help them find a solution. So sometimes we will get the question about a person's bite. How can you ensure that the teeth will come together, that the bite will be good that quickly without using a temporary? Fortunately, we are just experienced enough and have a very tried and true process that allows us to dial in people's occlusion, their bite, the way their teeth come together, really quickly without any issues. In extremely rare instances, if there were to be a problem, we would just help alleviate that and help solve it. So not something we're worried about, and certainly shouldn't be something that a patient's worried about. As a patient with us, the most important thing is staying in really good communication with your team, right? With your team at the center. Whether you have, concerns immediately after your procedure, even a long time after your procedure, say it's been, months or even years, most important thing is direct communication with your doctor and with the clinical and the care team at the center, right? I actually think that's really important. We have these wonderful communities. We have a wonderful Facebook community. There's a lot of online communication that happens, all very wonderful. But occasionally someone tries to maybe get help online when really it's most important just to directly communicate with your doctor and with your care team at the center you were treated in. That's going to be the most efficient and quick way to make an issue known, a concern known, and then get help that you need. After you get your permanent teeth, you can eat really anything that's semi-soft and softer. A lot of times we give a rule of thumb, like if you could cut it with a plastic fork, for example, it's probably soft enough. Avoid things that are really chewy, right? So you don't have to chew it a ton before you can swallow it. But really, soft foods is kind of the guideline. Everyone after surgery will be on a soft food diet, and that will generally last around 4 months. So most people, their favorite foods include foods that are not soft, like apples or steak, what have you. We're going to ask you to wait to eat those until you get to that 4-month mark. Also, just be, communicate with your doctor, right? Because they're going to be the one seeing you, and they'll be the final one to give you the ultimate, go ahead to start eating your favorite foods. You can drink coffee, but we don't want it hot, right? So it's not the coffee. Coffee's not a problem. The issue that we want people to avoid is when you've just had a procedure, right, and things are healing and it's all recent. Really, really hot temperatures, can harm tissues. They can, encourage bleeding, they could maybe speed up the dissolving of sutures too quickly, something like that. So we just recommend you avoid hot liquids. So warmish, lukewarm, or cold, that's fine, but avoid hot things. So a common question we get has to do with speech. Will this affect, my speech, my ability to speak? Overwhelmingly, most of our patients don't really miss a beat, and they do just fine with their new teeth. Some people may need a little bit more time to adapt and get used to the feel and the presence of teeth, maybe where they haven't had teeth for a long period of time. And so that can be an adaptive process. It's rare for it to take more than a few weeks, maybe a few months to get used to it. A lot of our teams as well, a lot of our doctors will send people home with speech exercises, and that can be something as simple as counting from 1 to 100. Because as you practice, you get used to things. So if you're considering dental implants, I invite you to come in for a free consultation. We're experts at this. This is all we do. Dental implants is all we do. I'm certain that we can help you figure out what to do next.